All right, so interesting enough, 12 minutes? Y'all ready for a ride? Because the topic that I'm gonna be bringing forth to you it's a little bit of a different dynamic, but of course a lot of you are already experts in the field of this work, especially coming from the health side. I come from a very unique perspective in the school district with Broward County Schools. My name is Philip Harris, and I thank you all for this opportunity to share our story, our narrative, in a very quick ride, whereas we're approaching our 2-year mark when it comes to resiliency and our recovery. Our superintendent, Broward Schools, Robert Runcie, decided to create a district-wide, high-level position that focuses on the emotional recovery for our school district. As many of you have seen in the news and the media, have to start here. 17 children and employees' lives were lost in Broward County Schools on February 14th, 2018. So, that being said, it starts with those families, those victims that were impacted, because we also had students and employees that were injured as well. It is a ripple effect because you look at not just going up to the students, the staff, the employees, the community of the city of Parkland, Coral Springs. We had 2 municipalities that are the feeder schools into that school, Parkland and the city of Coral Springs. We had West Glades Middle School, which is right behind Marjory Stoneman Douglas, and Coral Springs Middle School. And then you look at the county as a whole. So by a show of hands, I ask everybody, how many of you have had to deal with a loss in a family member in your life or a friend? Everybody's hand is raised in the room. So imagine a child, brother or sister, which happened because this incident happened at Marjory Stoneman Douglas, the high school, West Glades Middle School. These students were literally jumping over the fence, over to West Glades Middle School, running inside the portable. They see blood all over them. They hear gunshots going. They don't know what's happening. They see some of them have cell phones, so they're tweeting mom and dad. Mom and dad are trying to hurry up to get to the school. The school is on lockdown. It was an emotional impact, not just in our school, not just in our community, but across the country. This was the largest mass shooting that we had in the public school system. Columbine was 20 years ago. So of course, our colleagues from Columbine reached out to us to try to provide help and support. Our colleagues from Sandy Hook, which was the elementary school, reached out to us. Our colleagues in Seattle, Washington, from the shooting that happened in Washington. But it's unfortunate that we're at a time where we're at now, where we're having to look at a lens of safety and security in our schools. We talked about our colleagues before in reference to the mental health in our schools. And so mental health includes the emotional, psychological, and social well-being, and it affects how we think and how we act. And it also determines how we handle stress every day in making our choices. So as we look at these different stages of our childhood and adolescent years into adulthood, there's basic reasonings of problems and practices when we look at the human development of our children, and specifically amongst our middle school students. As my colleague said, we have 35 middle schools in Broward County. I'm set up as a district-wide employee looking at all schools across the district. We're the 6th largest school district, as you heard, in the country. I have 34,000 employees that I have to, as a team, collectively change a behavior of mindset of how they focus back down to the school-based level to provide support, not just to the students, but to the teachers that are inside the classroom. These teachers at West Glades Middle School and Coral Springs Middle School and Marjory Stoneman Douglas are traumatically impacted. The way that they have to wake up every morning to go inside of a classroom to teach inside of the classroom with the pressure from the academic side of the house, from my chief of Office of Academics, our state standards that we have to meet, the parents' expectations that they have to meet. It's a lot of pressure for our teachers who are having to teach these children to stay on task but change their mindset because they're not mental health professionals. So unique model structure and way we moved in Broward County schools is that you have to look at what recovery looks like. We had a baseline function, traumatic incident, vulnerable state. We're now in a position of coping. There's helplessness. And as we're going to a recovery phase, a child or an employee could go 3 different ways. Post-traumatic growth, which a student at West Glades Middle School may find themselves in a situation where to cope amongst the trauma that they've recently witnessed, that they're studying more. They're not getting the sleep, as my colleague had talked about earlier, because they're staying up late, doing their homework, they're participating in extracurricular activities, and so on and so forth. So they may actually have post-traumatic growth. Is that necessarily a health thing? They may return back to a baseline. But I have to say, when you have an incident like this that happens in your community, the normal is not the same. We can't go to February 13th, what it was like before February 14th happened. So they have to identify what is the new normal for them. So there's a baseline, and then there's continued impairment, right? There are students, as we look at research shows that there's about 70% of children who experience some type of physical or emotional trauma, that approximately 20% of school-age children, youth, are diagnosed with a mental health disorder. Well, this data is increasing because the awareness around mental health. Mental health issues and challenges have been there, but multiple times, mom and dad said, you just have anxiety, you have anxiety, that's no situation, just study your homework, right? Instead of addressing the issue to get help. Because if your child is having the anxiety and the depression and then pressure academically inside school, wow, 5 minutes, it's difficult for that child to focus inside the classroom. So this is where we were as a district. We had to respond. We were in a responsive mode, right? So we had individual family therapists that were in our district. And blessings enough, the community responded. We talked about collective community impact. At the time, I was not with Broward County School System. I only been with Broward County School System 6 months, right? I was the Human Services Administrator for Children's Services for the Continuum of Care in Broward County, so I worked for the county. This is my first time working in the education system, so I come from a municipal county government experience. And the community responded, but we needed more than that because we had at least 9 therapists in our wellness center, which was a very unique model at Marjory Stoneman Douglas. We have 5 family therapists, 2 social workers, school psychologists, a nurse, and EAP counselors, but we needed more support. So we have our national partners that came on board originally with us. So we're starting to move into a recovery phase, right? So we're looking at not just the multi-tier approach, but we have a tier 1, tier 3, where every student across the district is receiving services with mental health counseling services across the district. So that's my full recovery team. So I work with all the various different chiefs across the system. And across the system, all the way down to the school-based level, we have a mental health team, at least 10 in each region of our school district, because mental health was so prevalent. That being said, we received federal funds that came down through the federal government, through the Department of Education, known as Project SERVE. We received blessings in our state legislation, a state allocation of $1.5 million that came from the state, and then an additional $5.1 million that came down to support our work in Broward County. Recently, our taxpayers took it upon themselves to maintain local control, where we were able to pass a referendum that is actually not one just increasing funding for teacher salaries, but provided more mental health clinicians inside our school system, which we're going to be bringing about 134 more practitioners in our school system to help across the whole district. So it's not just at Marjory Stoneman Douglas in that zone, which is critically important because that's where a lot of our resources went. But I have to state this. We had an incident that happened at Dillard High School, which was right in the center, in the heart of Broward County Schools, where there was a young child who shot another student at that high school, and the students and employees went to school the next day. Now, that was a community that was not probably as prevalent and well known as the city of Parkland. But in this community, we talk about equity, we talk about the racism that exists. That community had to go to school, so they would call it the 17+1 that was lost. So as we are gearing up to our 1-year mark, and in essence of time, this is the system that I deal with. And as you can see, student support initiatives and recovery and mental health is in the heart of the district. These are all the various different systems that I have to navigate through to make sure that we're changing the behavior to provide the services to our children, but to our employees who are on the front lines, which also includes our custodial staff, our cafeteria staff, who go through various different sorts of training. So our youth mental health first aid, our psychological first aid training. Because if a child is going through the line to get their food and they see that their arms have been sliced, the cafeteria staff are able to see that. They notice there's an issue there. So we are starting to do training even with our bus drivers. Our bus drivers, hold and behold, when this happened at Margie Stoneman Douglas, they were traumatized because they were going to pick up the students at school at West Glades Middle and Margie Stoneman Douglas, and they just see kids running on the bus with blood all over them. They don't know what's going on. They were traumatized as well. So we have to look at all our employees, not just our teachers, but it's very difficult. So quickly, you'll see as RPM represents myself, the program manager across the district, but I also have a colleague that was also created that is more school-based. Her name is Martha Rodriguez, and she's the service manager for recovery, who is more of a clinician. She was our clinical liaison that worked with our Hispanic families that lives were lost, as well as those that were injured as well, and she works directly with our family counseling, the zone, and then our wellness center. We have a wellness center that is at Margie Stoneman Douglas. But again, as a district, we couldn't do this by ourselves. We talk about the collective community impact. Our behavioral health providers are in our community. The Center of Mind Body Wellness has been a tremendous partner of ours. The National Center of Crisis and Bereavement, which happens to be here in California through the University of Southern California, Dr. David Schoenfeld. We work together collectively, and recently we've witnessed another incident that happened in California. And so, believe it or not, they've reached out to us. I've already started having conversations with them as they're trying to go through a healing process to maintain the normalcy, the new norm, to sustain the learning environment to the best of their abilities that they can. So thank you so much for your time. Thank you for the ride, because it was a very quick ride with a lot of information that we had to share with you with the incidents that we dealt with in Broward County.